Passengers leaving Liberia, Guinea, and Sierra Leone are already supposed to be questioned before departure and to have their temperatures checked with a remote sensor. Now they will be checked again when they arrive at Dulles, as well as at 4 other American airports that together see about 90% of the travelers from West Africa. Staffers from the Centers for Disease Control will lead them into a separate room and check their temperatures and ask them about any exposure to Ebola. Passengers arriving at Dulles from overseas say they are already facing some questions about their health.
They asked me if I have a fever or whatsoever that I feel on my body. I said I'm okay.
You said you're fine.
Yes.
Thank goodness. Federal officials have been considering for weeks what additional measures they could take, but warn that the only sure way to prevent new Ebola cases in the U.S. is to stop the disease's spread in Africa. El Hadi El Sayed is a driver for the World Bank.
I am worried. I'm really worried, especially for Africa, because it's like a nuclear bomb, dropped in West Africa, and it will spread so quickly.
I do believe in very strict pre-screening, and I think we need to be safe at home.
Sabahat Nawab is a primary care physician in Alexandria, waiting for her sister, who is flying home from a pilgrimage to Mecca. Dr. Nawab supports the stepped-up screening at Dulles, but worries that by the time people arrive here, it will in many ways be too late.
They've exposed people in the airplane, people on transit here, people at the airport, people in customs, you and I standing outside waiting to meet our loved ones and relatives.
Now, it is going to be up to CDC personnel to determine if passengers who have fevers or have been exposed to Ebola need to be hospitalized right then and there, whether they should be handed over to the local health department here for further monitoring, or whether they should be allowed to continue on their way. But the CDC director has been warning that there could be a lot of false positives here. A lot of people have fevers, and those false positives could end up ruining people's trips unnecessarily.